Point in their lives, but how many will have the pain just go away all on its own, and who should actually seek treatment? Dr. Vijay is here with more. Good morning.
Good morning.
So it seems really everybody has had back pain,
right.
almost.
That's
Now
right.
it's usually in the lower back, right? What is that about?
Well, lower back is the part of the back that's affected most of the time, and you know, it's related to something that a person who's not used to a certain activity suddenly performs heavy lifting or heavy exercise or what have you, and also doesn't lift correctly or perform that active correctly.
Okay, I had this happen to me, and it was very sharp pain.
That's right.
And it was happening for months and months and months. I went to the chiropractor, went to physical therapy, went to the doctor. Nothing worked, and then one day, it just went away.
That's right. You know, that's the thing about back pain. Most of the time, it does go away on its own. Really, the best treatment, as for anything in medicine generally, is prevention. And the way to prevent is twofold. One, to keep your body fit. And the way to avoid back pain the best is to keep your hamstrings stretched and loose so that, you know, maintain your flexibility. The second thing is to have strong abdominal muscles. So by doing crunches or, you know, however you like to work out your abdominal muscles. So these two things together help prevent back pain. And the second set, or the second part of that, the flip side of the coin, is lifting correctly. Lifting with your legs and not your back. Or wearing appropriate protective equipment when you're lifting heavy things at work.
When you're saying lifting with your legs and not your back, what do you mean by that?
In other words, you don't want to stoop over and bend down and lift. You actually want to squat down and lift up with your legs. Because when you stoop over, your body, all the strain is on the muscles on your back, and you really don't have as much mechanical advantage, as opposed to when you squat down, grab it with your legs, and push up with your legs. You got the stronger muscles in your legs working.
Now, one thing the doctor asked me was, do you feel pain radiating down your legs? Which I did not, but what does that mean?
Well, you know, as the photograph shows you, it shows you the spinal cord and then the muscles of the legs. Most back pain is due to spasming of the muscles. And when you have spasming of the muscles, that rarely causes pain to radiate down the legs, because what the spine does is it provides a route for the spinal cord and the nerves to come out of the spinal cord and supply all the sensation in your legs, arms, really everywhere except for the head and neck area. So if you have, say, a bulging disc that you see in the photograph that's actually compressing on a nerve, then you'll have pain radiating down the leg. Now, even most of the time, even with the bulging disc, it resolves on its own without any, medical or surgical treatment.
Okay, but you say pain down the leg and then also having trouble controlling your bladder?
That's right. That's right.
What is that about?
Well, it's the same thing. When you have the bulging disc, or sometimes even the bone itself fracturing and causing a compression to the cord, you can have pain radiating down the leg or arm, depending on the location of the back that you're having the pain. The other thing is weakness. That's also something to be very aware of. And loss of bowel or bladder function is a big deal, suddenly becoming incontinent.
Okay, so now does back pain, does the chances of getting it increase as you get older?
Yeah, unfortunately, as everything gets higher as you get older. You get more osteoporosis, so there's a high risk of actually getting fractures in the spine. And also you tend to get a little weaker, you tend to get a little bit less flexible as you get older. So all these things make you more prone for back injuries, ranging all the way from muscle spasms to fractures.
In general, if you suffer from chronic back pain, what should you be doing?
First thing is exercise. So stay flexible and keep your muscles strong, your abdominal muscles strong. And then the second thing is to lift appropriately. If you don't know exactly how, then either speak to your physician or your exercise specialist or somebody to learn how to learn proper body mechanics.
You should lay down with your knees up?
That's right. Laying down with your knees up when you have the acute back pain relieves a lot of the stress on the lower part of your back. So you can do that for about a day or two. Not much longer than that, because if the pain lasts more than 3 days, you should really get some kind of treatment.
And remember, Dr. Vijay is here to answer all your burning medical questions. So if you have one, you can shoot us an email at news@KIIITV.com, and in the subject line, write "Doctor is